So, I think I'll start us off, and then Laurel's playing timer. Thank you, Laurel. Just to give you a sense of why we're here, this has been planned for a long time. I started at Food First in early 2020. This was on our work plan then, and then there was a snow again and a pandemic, and a few things happened. But this has been a conversation that we've been wanting to have and that we've been hearing from folks in the food charity sector for a long time about. We also know that that system has been shaken up by the pandemic in some important ways. Some of you folks in this room may not have considered yourselves part of food charity until the pandemic brought food programs into your life or into your organization. And it feels like this is the moment where maybe we can reflect a little bit on what this could look like going forward before things solidify again, right? You know, a lot of the current model of food charity was built in the early 80s, responding to the recession then and kind of solidified from there. And so this is a moment of change. I think Dr. Tarasik really highlighted, and we'll talk a lot today about the policy opportunities in this province. But I think the most important thing, we're all feeling this, any of us who work on the ground, the urgency of this moment right now. Anyone here who's providing food charity programming knows that it's wild out there and people are suffering. And so I think it's a really important time to have this conversation. I'll hand over to Alison to tell us about what we did.
I'll start us off. I want to start us off by just talking about our conversations over the last 8 months. So we started off this process with 2 surveys. There's QR codes all on your tables if you want to snap a pic of that and go dive into the surveys. You're more than welcome. But those surveys helped us understand the current landscape of food charity and access in the province. From these, we hope to identify topics of interest and space where change was most needed. One survey focused on those with lived experience of food insecurity, and the other focused on food programs specifically. These surveys were a great starting point, and we dove deeper into some of these topics of interest and held regional conversations across the province with food programs. This gave insight to regional specific barriers. Most recently, we had concluded conversations with people with lived experience. We offered 16 grants to non-food related organizations to host conversations on our behalf. We had over 75 participants express their thoughts, concerns, and opinions about food programs as a whole. All these conversations led our process and will continue to lead our process as we go through the day and when we plan our final recommendations and report.
So we want to start today with the voices of lived experience. And what this is now is some top-level themes that we've been able to pull both from those surveys and from those conversations that our partner agencies led. And you'll notice Alison mentioned that we didn't ask food programs to do this. I think we wanted to be in a situation where folks felt really comfortable sharing their experiences. And I think one thing we all need to recognize as people who operate food programs is we're in a position of power over people, right? People are coming to us for support with their basic needs, and they may not be comfortable telling us about their experiences with us. And so we worked with agencies who support folks who might also be reaching out for food charity. I think that's just to explain why we went that way with this. The first, and oh, this is yours. Sorry, I was introing it. There we go, thank you.
Yeah, you could talk forever, Josh.
Okay, yeah.
So for stigma, that was the biggest thing that came up in every single conversation. The responses we received raised concern that the stigma around accessing food services. Stigma is probably the biggest barrier for people accessing this type of support, but it seems to be a barrier at every stage. So that means before they even decide to reach out, when they actively use the service, but also on a societal level. Throughout the slideshow, you'll see some quotes there on the right-hand side. I'm not good at directions, so please read them as we go through the presentation. They're really powerful quotes from all the conversations over the last 5 months with people with lived experience as well as food programs.
And those quotes will be rotating on the screen during the breaks today, so don't worry about if you can't read them from here, just the voices will be present throughout the day. Another really powerful theme that came up in our conversations with folks living with food insecurity is around accessibility. The challenge they found in accessing food programs. And they really talked about this in 2 ways that I think are important. One is geographic accessibility, right? A lot of people in this province don't live within easy reach of a food program. Even here in St. John's, for example, I think lots of us know how much transportation delivery has mattered to people since the pandemic in terms of changing people's ability to access things. And they also talked a lot about the physical accessibility and the physical spaces the food programs were in. So the experience of lining up outside, being seen, waiting to be supported or served, or waiting in the cold, those kind of things. I think people really powerfully feel that barrier, and that was one of the things that keeps that number of people who are food insecure so much bigger than the number of people who are knocking on the doors. Oh, is it someone else in me? Oh, there we go, see? I tried to get off stage, I'm trying to learn a lesson. So Dr. Tarasuk talked a lot about income-related solutions, and so did people living with food insecurity. That's probably no surprise. I think any of us who work on the ground in this space know that people are experts, right? People are navigating these incredibly complicated systems. They're spending a ton of time figuring their way through the different places they can go for support, the different programs, the different eligibility requirements. I mean, it'll blow your mind, right? And so people had a lot to say about how important it was to increase those kind of cash supports that Dr. Tarasuk mentioned. And of course, you know, we've been having these conversations this year. Food prices were just dominating the conversations with so many folks. And like that's no surprise. It is changing people's lives, and it's changing who is showing up for food charity. I think you're all probably seeing that. And that's, I think, you know, to the last point here, lots of folks accessing food charity right now are in the workforce and just know that they cannot make those two ends meet no matter what they're trying. And that's something really important to remember.
All right, 1 second, Josh. I think we might have.
See, there we go.
All right, so I will go twice. So another thing that was brought up in all these conversations with people with experience was choice. With more people struggling to buy food, there's more people accessing food charity. But this means there's an increase in people needing specific food needs. This could be anything from people needing cultural foods, dietary restrictions, or simply people just having their food preferences. Choice is a very powerful thing. It gives people agency to choose the foods that they prefer and food that is safe for them to eat. Having options was at the top of people's minds throughout every interaction, whether it was the survey or the conversations we held over the last couple months. Another thing that many service providers told us about was dignity using services. Generally, many service users expressed embarrassment and shame when accessing food charity. It seemed like the biggest friction point with the system being the proof of eligibility and having to show anything like MCPs, pay stubs, and proof of housing. On the other hand, it wasn't all negative. Many people did express their thanks and gratitude and notice how kind and considerate a lot of the food programs actually were for those who had used the services. And they wanted us to let you know to the food programs, just like a thank you to the staff and volunteers, because it was noted throughout all the surveys as well as the conversations.
So we'll move now into what we heard from some of you folks. Some of you were probably part of the conversations that are reflected here, but these were the regional conversations that Alison led around the province. And so, I think this one's mine. Hey, there we go. All right. So we heard a lot about stigma from food program providers as well, right? I think pretty much everyone we talked to knew how much of a barrier and how stigmatized accessing food charity is, and we're thinking all the time about how to reduce it. One thing we did hear is that building a culture of confidentiality is a real challenge. So lots of our programs work with a big pool of volunteers. We might not have the resources or time to train people into the kind of confidentiality that the clients are looking for. And in general, like, everyone just told us how strapped they were, how few resources people have, how little space people felt like they have to try new ways of doing things, or to try doing things differently, to try and reshape our work. And then COVID itself really added some stigma into the equation in some ways. So on one side, you did have the growth of delivery and things, but on the other side, food programs all over the province had to physically shut their doors. So people were now kind of lining up outside a building, and someone would, open the door, pass you your hamper, and send you on your way. And that the physical experience really shifted in some ways that really challenged, I think, programs and their clients.
So the next very big topic of conversation over the last 8 months of food programs was advocacy. It was brought up a number of times through the whole process. It wasn't only advocacy within the food charity system, but also outside. From what we heard through our conversations with food programs is that food programs don't feel empowered to say no to food donations. In a time where donations are scarce and funding is low, it's hard to turn away food even if you have a surplus. For food programs with government funding, there is a perception of risk that if you speak out, they might take away your funds. You just don't know, so you don't want to risk it. There's also perceived risk of alienating donors. If you choose to take a stance, it may not align with the ideals of some of your donors. Within food programs, it's the time, money, and personnel that limits advocacy work. Most people express that there's not enough time to advocate when you need to focus on operations and actually feeding the people.
The other thing we heard a ton about, and hopefully will be a topic of conversation in this room, is collaboration amongst food program providers. So there was really an overwhelming feeling talking to folks that people felt like their work was still siloed, that they didn't necessarily know what the other food programs in their community or in their region were up to, that they didn't quite have a pathway to work together to support the folks who are usually accessing multiple points of access here. There was lots of interest in sharing resources across programs, we heard that a lot, but not a lot of people felt like they knew how to go about it. And I think that's something that we can talk about in the room today.
So continuing with accessibility, through these conversations, food providers know and recognize how much distance is a barrier. There's places in the province where the closest food bank is over 50 kilometers away, or people live in cities and towns that are not easily walkable and public transit is ineffective or non-existent. And from what we heard, food programs try their best to accommodate when possible, but it's not always an option. There's actually one place through this whole process where the ideas of providers and users differed, and it was about access. Food programs focused on distance and how it is to physically get there, but users spoke a lot about the operating hours and the physical location of food programs. It was interesting because throughout the entire process, all other thoughts were pretty aligned, and there wasn't a lot of gaps other than what access meant to users and service providers.
We also heard, of course, a lot from service providers around resources. And I think there's a few places where the gaps in resources are especially evident. I think this is probably no surprise to folks here. Gaps around dietary needs is a huge issue, right? So folks, anyone who is eating, for example, a gluten-free diet or a diabetic diet, they're really struggling, and programs are really struggling to support them. As we said, there's a lack of resources to explore doing things differently, starting new models. We know that food programs, by and large, are reliant on donations. So most of the folks in this room are not receiving government money in any meaningful or extended way, aside from the funds that flowed during COVID, right? And it just felt, I think, to us talking to folks, that there's just this overwhelming sense of scarcity in our world right now, right? That everything is tight, everything is short, there's never enough time, never enough money. And that really, I think, shapes this work. And service users told us how much they understood that, how much they saw the volunteers and the staff of food programs working within these constraints to do the best that they can. So I think there is a relationship to build on there that's really positive.
So we kind of touched on this a little earlier, but in the surveys, we kind of put forward different ideas that are happening across the country and the world. One being a grocery store model at food banks. There is a lot of interest for this type of idea, but as of now, there wasn't a lot of people who moved towards it, and that is because of the funding and limited resources. Gift cards were also very popular in the pandemic. This was obviously because of the increased funding, but very few programs still offer this kind of service. We talked a bit before in this presentation about the awareness of demographic shifts and the need to support diverse populations. With a changing population, there is a change in food needs, and we need to find a way to support this.
And I'll circle back to what the service provider perspective was around income solutions. We heard a lot about basic income talking to service providers, for sure. I think lots of us are into this conversation, but folks didn't feel like they had a way to act on it, right? I think a lot of us have talked about this, maybe around our dinner tables or with our leadership teams, but there wasn't a clear pathway for folks involved in food charity to support the creation or construction of these solutions. That came through loud and clear for sure. So I think I can do this transition here into what we are trying to do with this is synthesize some ideas about what this could look like going forward. What could all of our work together look like going forward? I think I have the first slide, or do you? Let's find out. It's a mystery.
That's me.
Oh, that's you. All right.
So this question here, folks who are food insecurity design and food program, this is a really interesting topic of conversation that we did in our conversations that just concluded with folks with lived experience. We just wanted to see what a food program would look like to best fit their needs and to best help them. At the top of the list was privacy and confidentiality, to know when they access support that they won't be a topic of conversation later, or to feel safe when they use the service. They also suggested better hours that were better suited to their needs. So for folks who are now in the working class or are students and they can't get there during the day, evenings and weekends were noted. They mentioned it'd be great to have access to other products and services like hygiene and household products, clothes and pet food, but also having other types of services like having doctors available and that type of thing. Also came up was a combination of allergies and dietary restrictions, and with cultural foods as well. Basically just creating a space where people feel comfortable in asking what they can have and what they need. They also mentioned more community programs, having meals and community gardens and that type of thing. So if you go to a food bank, possibly have a meal available so they can eat right away. Having a more welcoming and understanding environment, a place where they don't have to prove anything, they can come as they are and just get the help that they need. Transportation and delivery would be ideal for most, and they also mentioned that with COVID, we all know that we had to move towards appointments and pickup times, so you knew when people would show up. A lot of people enjoyed that. They really liked having the appointment style, knowing when they had to pick it up and knowing they wouldn't have to wait in a line outside. In almost all conversations, service users mentioned the unlikelihood that all of this could happen because of obviously the limited resources and staff time. But they said they know that change isn't easy, but they believe that it could happen.
So we have some specific ideas about what this could look like that we try to distill from this process. And one of them is around what could more shared infrastructure look like in our world of food charity, right? A lot of us are running programs that are very small. Around this province, there are many food programs that have no paid staff at all. You're lucky if you have one. You're very lucky if you have more than one. So one of the things folks brought up would be what we could do to build out some of these shared services. Many of our organizations couldn't sustain a delivery service on our own, but could we share one? Could we share the cost of hiring staff that can connect people to the other things that they need? So mental health, housing supports. Again, very few of our organizations could employ a full-time social worker, for example, but can we pull together to employ one? To consider merging with other organizations. There's also a lot of us. Do there need to be as many of us? Do we need to be in a situation where as a community, folks are going to multiple organizations with multiple kinds of requirements and rules and times? And then establishing things like shared minimum standards for client services. And those of you who are part of the Food Banks Canada network would know they're really kind of working in that direction right now. And can we pool donations, pool finances together to support some of this work? And so for a lot of us, that would mean giving up some things, giving up some resources and some control. But there's a potential for a smoother system that shares more.
So the next topic I want to bring up is rethinking the community food helpline. As we mentioned before, it's been around since May 2020, and the need for people reaching out to us has just been increasing exponentially. So we've been thinking about how the community food helpline fits in with Rethinking Food Charity. There's been ideas like integrating this service with a shared service model that's been brought up, mainly exploring how to restructure the community food helpline model to effectively fill gaps in food support rather than maintaining a regular client base. We've been considering whether the helpline should be a standalone organization or housed within another provincial program, but essentially all of our ideas just boil down to scaling back the services as a societal safety net strengthens.
Talking a little bit about reducing barriers, I think there's some specific recommendations here that are really grounded in what we heard from people. And one of them, one powerful one that we heard over and over from clients was, can we end the use of the MCP number as the gatekeeper into the system of food aid? That doesn't necessarily mean not having unique identifiers for people, but there's a lot of challenges with using people's health card number. People approach programs and they feel like we have access to their health data if they're handing over their health card to us. There's confidentiality challenges, and there's the challenges with accessing MCP. So if you've lost your MCP card, it's quite a process to get a new one. Should that process be what keeps you from getting fed that week, right? And so I think there's some thinking about if there needs to be any kind of shared ID, could we build a system or leverage some of the systems that already exist, like in housing and homelessness. There's databases and there's work that we can do. Similarly, we heard a ton from clients about how difficult it was for them to be asked to prove that they're poor enough to access our supports, right? And so, people are being asked for things like proof that they're on the low-income drug plan, or a stub to prove that they're on income support, proof of their income in all sorts of ways, and just, it was hard to see why those were necessary, really, and why we would set a threshold like that. And so in general, where we can, if we can end the use of those kind of other documentary verifications, proving whether you have custody of your kids, proving your date of birth, whether you live in a certain neighborhood, that's a huge burden, particularly on folks who are at their most vulnerable. And so I think this really came through, I'd say, in our conversations with service users as the place things needed to change the most.
So stigma has been at the top of conversation throughout this entire presentation. But kind of when you think of minimizing stigma, think of how can we make the system feel like it's working with you instead of against you. One idea is to move forward picking up your own food at a food bank or offering gift cards. So moving away from the pre-packed hampers that you just give out daily. One idea, intentionally plan to minimize lineups outside with waiting areas possibly indoors, or having appointment times so people aren't just lining up outside wanting to get food. The other thing that was brought up a lot was confidentiality. So to help minimize stigma, having mandatory training for volunteers and staff on confidentiality and working with vulnerable populations can be a step in the right direction and make clients feel more comfortable when reaching out for help.
So that's the recommendations I think we were able to pull from these conversations for how to change the system that we have, right? I think we can all recognize that we're not going to be in a world where tomorrow the need for food charity goes away. But we can imagine a world where that can happen, and it's not super far away. And so we also wanted to think about how do we, as a sector, pull together to reduce the need for these services in the first place. I think this one's fine. This one? Yeah. So one of them was around doing things like this, right? It's not actually that often that we have a chance to get together and to convene. There are a few small circles of food programs who talk to each other quite a bit, but can we convene more? Can we convene around advocacy areas, around things like wages, income, basic income, those kind of things? The other thing we think there's a huge opportunity that maybe not all of us are always that aware of is just how many national partners are out there who are game to hold our hands through this. So we'll be hearing from folks from Community Food Centres Canada later today They have a ton of resources to support these kind of transformations. Food Banks Canada as well is moving really in a direction that's quite supportive of this kind of work. There is a lot happening outside of this province, and people are really eager to help if we reach out. And on that, can we figure out a cost-sharing model so that some of this work can happen, so that it can be someone's job to advocate and to speak for the food charity sector in these conversations is really important. This is one of my two. Oh, nice, good headphone there. The other one, and I think we spoke to this, around how do we make this case? One of them is, can we build out or buy into some of that shared data infrastructure? So there's a few of us here who have worked with the homelessness system, which has actually a pretty solid ability to attach data to individual client numbers and understand the journeys people are on. Right now, the best we have really is the national data, and we have the hunger count. And the hunger count is one day in March. I think real-time data about when things are getting bad in this world, so that we can say something happened and look, next week things spiked. That's not a conversation we can have right now, but that could change. And similarly, I think one of the things we heard from talking to people is they were really happy to be able to share their experiences in this world. And lots of folks who live with food insecurity don't have that opportunity very often. And so can we create a regular opportunity for people to share that kind of feedback and feel safe doing it, right? And can we work together a little bit more to create policy proposals to share and sign on to things and put our names on some of these ideas? This one is yours, I believe.
Yeah.
There we go. How do we get it done, Alison?
Yeah, so we're trying to figure out, we threw all this information at you. We want to make sure that you have some resources at least to kind of figure out where we can go from here. So there are existing network organizations like the Community Food Sharing Association, Food First NL, Food Banks Canada, and more that have broader connection and they can help you network and make just collaborate more in our efforts with food programs. There's also the Community Services Recovery Fund. It's a new federal grant to help charities and nonprofit adapt and modernize. That was released last-ish week.
Yep.
There's also the idea that we put forward of pooling private donations or engaging collectively with charitable foundations. There's also the ongoing social and economic well-being plan, as well as the Health Accord recommendations.
So I think the stage is really set here, right? There's some big ideas that we've tried to pull out. There's a lot of places where if we want to make a change, I think we can do it. And so we want to leave you with that and leave you with some of those ideas to inform the conversations we're going to have with each other for the rest of today. So I just want to say a huge thank you, I think, to Alison in particular for leading this work for the last year. It's been a lot of work and a lot of planning and a lot of difficult conversations with people, hey? So thank you, Alison, for bringing all this to us.